The first step in solving the problem of chronic pain is to put the right diagnosis. The first thing she did, she went to her husband and she said, "You see, I'm not crazy." After you put up the right diagnosis, you make a small incision under WALANT and you actually decompress the nerve.
Hello, everyone. We welcome with us Dr. Omar Fata. You are an orthopedic surgeon here in Serbia. I'm very interested to know more about you.
I'm an orthopedic surgeon, but I'm not a classic one. I do mostly peripheral nerve surgery and chronic pain surgery.
That's very interesting. Actually, as an orthopedic surgeon, most people wonder why you focus on peripheral nerves. Aren't orthopedic surgeons mostly about bones and joints?
Well, that's an interesting question. Actually, the musculoskeletal system is not about joints and bones. It's also about tendons, muscles, and nerves. Nerves, they play a very important role between the brain and the extremities. While most orthopedic surgeons take care of joints and bones, nerves, they are quite overlooked by all specialties, by orthopedic surgeons, by plastic surgeons, and by neurosurgeons. I decided to take different path to take care of peripheral nerves and to cover this gap in patients' care.
That's fascinating. You also treat chronic pain and extremities. Can you explain to us what is that about?
When I talk about chronic pain surgery, I'm referring to procedures meant to eliminate chronic pain caused by peripheral nerves that are compressed or irritated. These conditions are often misdiagnosed as something else, mostly like radiculopathy or like tendinopathy or muscle spasm causing pain. But in fact, the problem is actually attributed to nerve compression within the same extremity.
That's actually really interesting. How can someone tell if their pain is peripheral nerve related?
Actually, there are a few key signs to know if the pain peripheral nerve related or not. So first of all, the pain is radiating in nature. So this is very, very characteristic for nerve related pain. So the pain can be hardly localized. They will not be able to tell you, oh, the pain is here. So they will not use their finger. In the history of the patient, there is no trauma. They can't recall an occasion related to the onset of symptoms. The pain is accompanied by numbness or by weakness, muscle weakness, or by loss of endurance. These are key signs that the pain is nerve related.
Can you give us also examples of patients you commonly see?
Yeah, of course. There are three main categories or groups of patients that I usually see in my clinic. So the first group is patients complaining of shoulder pain.
Okay.
That is radiating to the elbow or to the forearm or even to the hand. The second group of patients that come to my office complaining of numbness in the hand or weakness in the hand. And the third group of patients are actually related to the lower extremity, that they come due to pain around the knee. That pain is radiating up to the groin area through the thigh, or sometimes radiating down to the ankle area or to the foot. These are pretty much common examples. Many of them get, I wouldn't say wrong diagnosis, but get far away diagnosis, far away from the main problem, which is peripheral nerve compression.
So I also have a question about how can a person know, a normal person who doesn't know much about medicine, that they have chronic peripheral nerve compression?
So the patient will feel chronic pain. They will have some complaints regarding muscle weakness. So for example, in the upper extremity, the patient will say, objects are falling. I'm dropping glasses of water. I'm breaking a lot of glasses of water. I cannot open a bottle. I cannot open the door very easily. Or I cannot hold my baby. For muscular men, I have them coming to me because I cannot wrestle. Yeah?
Somebody arm wrestling them.
Arm wrestling like when I was young. So I don't have power anymore to wrestle. In the lower extremity, patients complain of claudication. They use a crutch, for example, or they have difficulty going up and down the stairs. They are not pretty much sure about their gait. All these examples can be potentially due to nerve entrapments or nerve compression in the upper extremity or lower extremity.
Can you tell me an interesting case that you had throughout your career?
The surrounding people of the patient, they think that they are crazy somehow. So one patient came to me, a female patient, middle age, between 35 and 40 years of age. And she came to my office, and the first word she told me when she saw me, "Doctor, I'm not crazy."
Yeah.
I told her, "Okay, I believe you. Just let me know what's your problem." She said, "I have chronic pain in my left hand and in my left groin and in my left leg that no one believed. And I just want to tell you, I'm not crazy." Again, she repeated twice. It took me with her around 1 hour to discover 3 nerve entrapments. 2 in the upper extremity and 1 in the lower extremity. And when we solved the problem, she didn't believe. The first thing she did, she went to her husband and she said, "You see, I'm not crazy." No one believed me. So this is not the only case, especially in females, that they come to me trying to convince me that we're not crazy. And she has been to gynecologists, to physical therapists, to rehabilitation doctors, to another orthopedic surgeons, and they did all the lab work, all the diagnostic investigations, and everything was normal.
Also, now, what does surgery look like? Is it a major procedure?
No, it's not a major procedure. It's you can call it a minimally invasive procedure. Why? Because we're doing the operation under local anesthesia, under a technique called WALANT. So it's a wide awake. The patient is awake. WALANT stands for wide awake, local anesthesia, no tourniquet. So you don't need a classic operation theater. You can do it in a one-day surgery unit. Using local anesthesia, the patient is awake and I'm talking with the patient. So the purpose of surgery, after you put up the right diagnosis, you make a small incision under WALANT and you actually decompress the nerve. So you are releasing the pressure on the nerve from the surrounding structures, but you are not manipulating the nerve. You don't need to manipulate the nerve. You just need to take off the pressure from the surrounding structure.
And as a normal question, how long will it take to heal from that, to recover from the problem?
The recovery is variable, but immediately after the operation, they will encounter a dramatic relief. The full recovery will be within a month, but a dramatic relief will be immediately after the operation.
That's actually
Yep.
like sounds like a game changer for many people, which is
Yes, of course.
something good. Any final thoughts you would like to share?
I would like just to emphasize about the fact that peripheral nerve caused chronic pain is something that is poorly understood and can be misdiagnosed. And that's why we need a right diagnosis. So the first step in solving the problem of chronic pain is to put the right diagnosis. Once you put the right diagnosis, the next step is pretty much easy. My message to anyone that have a persistent extremity pain is to seek medical attention with a doctor that is familiar with peripheral nerve. So I'm here to help. And of course, helping a patient with the chronic pain, as you said, is a game changer, and you can completely improve the quality of life of the patient.
That's actually very interesting. Thank you, Dr. Omar Fata,
Thank you
for
so
shedding
much.
this light on
Thank you.
this
Thank
important
you.
topic.
Appreciate
So
it.